We also know the pressure that our health workers will come under during the next few months, and I can't say enough how proud we are of our frontline staff across the board, but especially our health workers. They will be front and centre of when the numbers of people requiring hospitalisation increases, and that's why I'm very grateful to the Treasurer, who's found an extra $100 million here in New South Wales to support our frontline health workers, because those of us who are still exposed to a broad number of people worry about giving the virus to our loved ones, and I know that's especially the case for our health workers. They want to protect their families, they want to protect their loved ones, and that's why we're offering free accommodation and free parking for our health workers, so they don't have to worry about taking the disease home and unintentionally passing it on to their loved ones. At least that's one less thing for them to have to worry about. But in the $100 million package, which goes towards supporting our health workers on the front line through free accommodation and also free parking, we're also providing an extra $35 million to vital research. You know, for the first time in a long time, every scientist on the planet is working towards a vaccine, working towards a cure. And of course, we want New South Wales to be part of that story. We want our best and brightest in here in New South Wales and across Australia working their guts out to make sure that we find a vaccine as soon as possible. Because the reality is that until we find a vaccine, we all have to live with this virus. And no matter what restrictions there are in the future, no matter what restrictions are potentially eased in the future, until a vaccine is found, social distancing is a way of life now. That is the new normal. Not having physical contact, socially distancing is at the very minimum a way of life for us, because we have to be honest with ourselves. Until a vaccine is found, there is no simple way to deal with this issue. And there isn't a country on the planet that's worked out the secret formula. Every country is dealing with it as best they can, some better than others, but there is no secret to success, because the virus is so contagious, and we know it impacts the vulnerable in particular, but as we've seen around the world, it also affects young people and middle-aged people if they've got an underlying condition or if for whatever reason their immunity is low. So please don't think you're immune. Please make sure you stick to the rules, and that's why, especially over Easter, it's really important for all of us not to travel, not to get in the car and go to a different location to think that it's okay, because it's not. It only takes a handful of people to do the wrong thing, and it can spread the virus through the community, through sources we can't identify. At least with overseas travellers, we can isolate, we can quarantine, we can make sure they're not mixing with other people. But when it's acquired through the community, and you might not even have the symptoms, we don't even know. You could be walking around giving the virus to people in your life and people that you're mixing with. And that's why all of us have to act as though we've got it, or that the people we're dealing with have got it. That is the only way to stay safe. And I know that it's especially hard for families and communities that come together over Easter and during Passover. I mean, these are very special times for many families. And for my family, it will be a very different Easter, as I know it will be for many families across the state. But this is the world we're in, and I'd much rather have to go through that bit of pain rather than risk the life of one of my loved ones. And that's what I'm urging everybody to think about over Easter. I'll now ask Commissioner Fuller to give an update on his operations, then Dr Kerry Chant will give us an update, then I'll ask the Deputy Premier to talk about Easter in the regions, and then the Treasurer to outline in further detail the announcements we've made in relation to health workers and finding a vaccine. Thank you.
Good morning. Thanks, Premier. The police and emergency operation continues overnight, and from the Swiss Hotel perspective, this time tomorrow, over 200 Australians will be allowed out of the hotel, and no doubt they will be relieved after their period of isolation to go home. There are some non-New South Wales individuals who will be transported to the airport. They'll be giving a letter from me confirming their period of isolation, and I certainly hope when they land back in their home states and territories that they are allowed to go home. After that, we'll be planning for the coming Sunday, Monday, Tuesday, where some 3,000 Australian residents will come out of hotel isolation, and we thank all of those Australians for their patience over the period of the 14 days. From my perspective, in terms of an update on crime, I know domestic and family violence is of interest. It's up slightly, but we're monitoring that daily. But things like alcohol-related crime are actually down at the moment. Assaults are slightly down. In terms of other crimes that around summertime you would expect to be up are either stable or down. So from a public safety perspective, I could just reiterate to say that people are safe on the streets, but please continue to report crime, knowing that police are out there. We are still seeing a steady flow of Australians coming back into Sydney Airport, and that operation is running extremely well with Border Force, police and other agencies, and we're using hotels across the Sydney metropolitan area, and we'll continue to have people under 14 days isolation. And we know those coming back from overseas are still high risk in terms of spreading the virus. Thank you.
So, as the Premier indicated, there were 49 new cases since 8 p.m. on the 6th of April, and that's down on the 57 we reported for the previous 24 hours. So, as the Premier has indicated, we have seen a stabilisation and a decline in new cases. This brings to the total 2,686 cases of confirmed cases. There's been 21 deaths, and that is 3 new deaths since we reported yesterday's figures. That's in an elderly gentleman, a 90-year-old male, died in Liverpool Hospital, and he was a resident of the Opal Care, Bankstown. The second death in a resident from that facility, and a 90-year-old male who died associated with the Dorothy Henderson Lodge in Macquarie Park, and he's a 6th death in a resident from that facility. And there's an 87-year-old woman who was confirmed was a passenger on the Ruby Princess, and she passed away, and that brings the deaths associated with the Ruby Princess in New South Wales to 5. As the Premier indicated, testing rates were down on the weekend. They have bounced back a bit. We had 2,100 people presenting for testing and were tested in the previous 24 hours. However, we are urging that we take this opportunity to encourage people to come forward for testing if they've got symptoms in the areas of Waverley, Wallara, Dee Why, Manly, Ryde, Macquarie Park, Broken Hill, Lake Macquarie, Manning, Nowra and South Nowra, Byron and Port Macquarie. The reason for this is in those areas we have seen a case or cases of local transmission where we haven't been able to find the source. And it is important this time, as we try and suppress the numbers of COVID-19 in the community, that we basically elevate and raise testing levels in vicinity of those areas, geographical areas, and we assure ourselves that we're not missing more broad-based transmission in those communities. We don't have any indication of broad-based outbreaks in that areas, but we do need to have high levels of vigilance. And in some of those areas, as I've mentioned before, particularly the Waverley areas, I have mentioned to you about previous outbreaks associated with Bondi. We have a range of strategies in response to that. So, for instance, there's been quite a lot of success with the pop-up at Bondi in terms of bringing people forward for testing. We will draw on a range of strategies working in partnership with general practice to increase testing in those areas, but I do urge the community to come forward for testing in those areas.